We've all become familiar with the stress, worry, and frustration the pandemic has brought into our worlds, and more than ever, the importance of caring for mental health is getting more attention. The Cal Hope Project offers safe and secure emotional support for all Californians during these tough times, with the goal to end the stigma surrounding mental health. Here with more is Professor of Internal Medicine, Director of the Center for Reducing Health Disparities, Dr. Sergio Aguilar-Gaxiola. Welcome to the show.
Thank you, Aubrey. My pleasure.
So talk about Cal Hope and why their services are so important.
Yes, Cal Hope is a federally supported effort that offers critical behavioral health crisis counseling programs to states and tribes after a federal declaration of emergency. This program, which is funded by FEMA and SAMHSA. FEMA is the Federal Emergency Management Agency, and SAMHSA, the Substance Abuse and Mental Health Services Administration. This program has two phases. The immediate service program, which helps people in need for the first 60 days of an emergency. And then there is a regular services program, which adds an additional 9 months following the immediate services program. And FEMA and SAMHSA are funding this crisis counseling program here in California and have recently trained 550 community health workers or promotoras to deliver these services, which are very much in need right now.
Yeah, no, the counseling, the crisis intervention and help that's available. What's been the impact of this pandemic on mental health?
Oh, it's been tremendous, actually. There is evidence that the pandemic has affected us all. And there are specific groups, for example, youth has been very much impacted in terms of, an increase in things like depression, anxiety, substance abuse, and including suicidality. There has been a significant increase, for example, in the 18 to 24-year-olds who had been seriously considering, ending their lives in the last 30 days. And we know that the pandemic has hit, all of us, but youth, they have had, have been hit, for example, with a truncated education, with not being able to see their peers, and the teenagers that sometimes make some money by having summer jobs or having some jobs to make a little bit of money and aspire, for example, to pay to buy a car. They have been unable to do so. So it really, from the mental health impact has been palpable, and we need to address it. It is the needs are dire.
Doctor, any tips, any one thing that we can all do to help manage some of the stress?
Yes, absolutely. There are several things that we can do. For example, something easy to remember is 3 P's, which is pause, to have a pause, breathe. It is important to pay attention to our breathing, and there are exercises that can help us with that. The other one is put down the remote. The media, many of the news, unfortunately, increase our anxiety because of the nature of the news that are presented. So take a break from there, and also prepare to communicate, meaning don't isolate. Please, I strongly recommend to reach out to those that you love and who love you, and it is one of the things that we can easily do if we are staying at home or if we have to work, it is of critical importance to tap into our support system.
All right, thank you, doctor. And if you want to learn more, you can visit calhope.org. And even as more places reopen and people start to receive that COVID-19 vaccination, it's still important to keep wearing a mask. Experts say masks don't slow us down. They keep us moving from the store to the park, for pickup game to happy hour. So keep wearing a snug-fitting mask with multiple cloth layers, because together we can end this pandemic. Visit covid19.ca.gov to learn more.